Once diagnosed with diabetes, many learn ways and develop a lifestyle to help manage their blood sugar levels. Here to talk about this today is Dr. Michael LeMay, an endocrinologist with Hartford Healthcare Medical Group. Dr. LeMay, welcome.
Thanks for having me.
Great to be here. So what is the difference between type 1 and type 2 diabetes?
Well, both type 1 and type 2 diabetes are chronic conditions that affect the metabolism of glucose or sugar in the body. Type 1 is when the pancreas can't make any insulin at all. It usually follows an autoimmune disease in which the person can't make any insulin at all, and so they have to inject it several times per day. They can't live without it. Type 2 diabetes, the pancreas makes insulin, but the patient is just the body is just not very good at utilizing it, and so they often have to use either pill forms or injectable forms of medication, including insulin, to manage their disease if needed. There's about 30 million people in the United States with diabetes, most of them type 2.
All right, what are the symptoms of diabetes and how is it diagnosed?
Well, there's a lot of different symptoms, and some of the most common ones are frequent urination. So if you're urinating a lot, especially if you're waking up in the middle of the night urinating, it might be uncontrolled diabetes. If you're urinating a lot, then often an unquenchable thirst is present also. Other things like blurred vision and weight changes are common in both type 1 and type 2 diabetes. The diagnosis itself is made by a simple blood test, either a fasting glucose level or a hemoglobin A1C, and so that's a reason to see your primary care clinician periodically to make sure you're screened for it.
Doctor,
especially if you have the symptoms.
Great. Okay, is it possible to have diabetes and not know it was my next question.
Sure. There's actually an early form of diabetes called prediabetes that a person might have, and they may not experience many symptoms. Another good reason to be screened at least once yearly by your primary care clinician, because if you have it, some simple lifestyle changes might help you not graduate to full-blown diabetes and might prevent you from needing medication at all, which would be awesome.
All right, what are some tips to help people successfully manage their diabetes?
Well, that's a fantastic question. There's so many things you can do. Certainly best diet possible, less junk food, less processed food, lower calorie diet, low carb diet if possible, physical activity as much as possible, whatever you enjoy, whether it's walking, biking, swimming, weightlifting, yoga, as much as possible, because best diet possible and physical activity are critically important in both type 1, but especially type 2 diabetes. You really need to find a clinician that feels comfortable with helping you manage your diabetes and that who you feel confident in can help you navigate the course of the disease. But there are a couple of other things, too, that when we think of diabetes, we often think of blood sugar, but other things include dilated eye exam at least once a year, making sure you effectively manage your blood pressure if you have hypertension, seeing a podiatrist periodically if you're a smoker, working on smoking cessation. All of these things help you avoid the complications of diabetes, such as amputation, neuropathy, blindness, all things we definitely don't want.
All right, endocrinologist Dr. Michael LeMay, thank you very much. Great information.
Thank you.
Thank you.